Hello and welcome to lyranara.com, the place where you can find the most powerful and efficient tools for taking care of your health holistically without any side effects, as well as the best natural supplements you can find anywhere. And not only that, but we also pride ourselves in giving you free, no cost attached advice every day updated on our blog and on social media. So make sure to follow us there. And we also make videos about interesting subjects that you should know about. And we offer you all of this knowledge, of course, for free here on our YouTube channel. And today marks another installment in our educational series where we learn together about powerful tools that cost you very little and help you a lot. And today's subject is DMSO, a molecule that is extremely powerful, has been talked about for a long time, and unfortunately in the mainstream media has been suppressed also for a long time. And in this presentation we're gonna learn everything there is to know about it. So what is it exactly? What illnesses can you treat with it? How efficient is it? What has been researched about DMSO? What are the results of all of this research? So without any further ado, let's learn more about DMSO, the persecuted molecule. Let's kick this off by learning what exactly is DMSO. So first of all, it was discovered in 1866 already by a Russian scientist called Alexander Zaitsev, who isolated the DMSO as a byproduct when he was converting wood into wood pulp. And DMSO is short for dimethyl sulfoxide. It's an organic sulfur compound and it's used as a very potent solvent due to its high polarity. It is the best solvent ever known to mankind for water and fat-soluble substances. It is also an intermediate product of the global sulfur cycle. It is generated in plants when it rains through oxidation of dimethyl sulfide. Thus, it is a 100% natural product. Among the sulfur compounds, DMSO has the widest range and the greatest number of therapeutic applications ever indicated as beneficial for prevention as well as therapy. And the applications, as you will see in this presentation, are endless, literally. Over 40 pharmacological properties are already known, according to Morton in his book written in 1993, and have been well documented as well. So this is no hocus pocus, quakery or something like this. This is well proven over the years. Unfortunately, it has never become mainstream for reasons that we're gonna see. Transplant organs are preserved in DMSO also due to the anti-freeze properties of DMSO, and DMSO2 is a DMSO derivative and is also known as MSM. And this will be a topic for a new article and a new educational video, so stay tuned for learning more about this very interesting subject as well. But today we are here to learn about DMSO and to hear some of the health indications that you can treat with DMSO. It's a very effective painkiller. It blocks nerves that conduct pain signals. It reduces inflammations and swelling by reducing inflammatory chemicals. It improves your blood supply to the injured area by dilating the blood vessels and reducing blood viscosity. It also increases the delivery of oxygen to your cells in your body. It is the most potent radical scavenger known to man, so transporting these substances through excretory ways, it scavenges all these damaging radicals. It also penetrates the skin and blood-brain barrier with ease and enters the bloodstream very easily, therefore it's very efficient, of course. It protects the cells from mechanical damages. It needs a fraction of time to achieve this compared with other pharma drugs. It has a calming effect in the central nervous system, and it reaches all areas of the body when absorbed through the skin. So it proliferates really well in your body. It also acts brilliantly as a carrier for all other drugs, supplements, and it potentiates their effects. So, for example, corticoids, antibiotics, and insulin have been shown to have less undesirable effects and can be used in smaller quantities when used in conjunction with DMSO. But that's not all. DMSO has many more therapeutic properties. Some of them you can see here. It promotes the excretion of urine. So many patients with different genital urinary disorders have been successfully treated. For example, patients with Peyronie's disease, interstitial cystitis, acute epididymitis. It is also a muscle relaxant. It boosts your immune system. It increases production of white cells and macrophages. It has antibacterial, antiviral, as well as antifungal properties. It increases the permeability of the cell's membrane, allowing thereby toxins to be flushed from your system. It has radioprotective properties against lethal and mutagenic effects of X-rays. It also has cytoprotective properties, so it protects against injury due to freezing. It inhibits cholinesterase enzyme from breaking down the acetylcholine, one of the most important neurotransmitters. It is the best heavy metal detoxifier as it binds to aluminum, mercury, cadmium, arsenic, nickel, and it eliminates all of those heavy metals via the urination and the sweating process. FDA has also approved DMSO for preservation of stem cells, bone marrow cells, and organs for transplants, as well as for therapy of interstitial cystitis. Another great thing about DMSO is that it is very, very easy to use. It is one of the most studied products with over 30,000 indexes found only in the US National Library of Medicine that you can find on pubmed.gov. It has many times demonstrated that DMSO is not toxic and its therapy profile is unquestionable. Pharma companies see no return on investment and therefore they do not promote DMSO. That's one of the main reasons why it's unfortunately not very well known and you don't find many articles in mainstream media about it. There is not a lot of money to be made from it. DMSO is generally applied to the skin in form of a gel, a cream or a liquid. You let it dry for 30 minutes and you apply it on a clean and dry skin, and that's how you apply it on your skin. But you can also take it orally or with injections, intramuscularly, intraperitoneally, intrahepatically, or by inhalation instilled into the eye, on the mucous membrane, and into the urinary bladder. The strength and the dosage vary on the condition and the application. If you deal with injuries or pain, you just use topically DMSO concentration of 50 to 70% on the wound. You start with, if you take it orally, with 1 teaspoon of DMSO, 50%, and increase to 1 tablespoon of 70% solution. Of course, supervised by a doctor to always check on the detox reactions. You can add aloe vera, and the effect is then less intense, and the symptoms are less intense, but the efficacy is still the same. You wait 30 to 60 minutes until the DMSO has penetrated the skin, and then you look further how to proceed. For pain therapy, you should take it for about 6 weeks. And you will notice most probably significant improvements already after 2 to 3 days. What else can DMSO help you with when it comes to therapy? Well, you can take, for example, 1 drop of a 25% DMSO solution that is diluted in sterile saline solution once or twice per day, and is very useful for eye problems, including cataracts, glaucomas, macular and retinal degeneration. It's also highly effective in vascular headaches and muscular tension, which so often goes with headaches, and here you just apply it on the hairy area between the eyes. DMSO is also extremely useful in treating mental conditions, for example, for acute schizophrenic reactions, manic depressive phases, all kind of psychoses, alcoholic psychoses, autism, stereotypia, delusional states, severe neurosis, anxiety, as well as obsessions. Schizophrenia, for example, treated with intramuscular injections with 50 to 80% DMSO solution, showed that every single patient was discharged from the hospital after only 45 days. With this treatment, they observed a quick decrease in agitation, a recession of persecution feelings, good tendencies to communicate, and a return to alertness and calmness. DMSO also in conjunction with other therapy has been shown to regress certain types of cancer. IV DMSO helps heal also leaky gut and morbus Crohn disease. And DMSO is as well an excellent scleroderma treatment as it reverses this lethal condition. Next, we would love to look a little bit more in depth at certain very widespread and serious conditions that have been shown to be very treatable with DMSO. And first up is stroke. Given soon after the stroke, DMSO can dissolve the blood clot and restore brain blood circulation, avoiding thereby other disabilities as well as paralysis. It is thus indicated in treating embolic and hemorrhagic strokes. There is usually an accumulation of water in the brain following a stroke, and this water puts even more pressure on the brain. And if you give DMSO immediately after the stroke, it helps decompress the brain, and therefore it helps avoid further damages and the death of more brain cells. The best way to remove brain clots is to apply it topically on the skull and add DMSO to the IV. Most of the brain damages can be avoided if DMSO is given immediately after the stroke has happened. However, even 3 to 6 months after the stroke has taken place, DMSO therapy can still add significant improvements to the condition of the stroke patients, as it helps other blood vessels undertake the circulation work and reactivate brain cells. DMSO also has been shown to protect brain cells from disrupting following a stroke injury. It's best to be applied topically on the skull, and you can also take it orally or intramuscularly as injections. And the recommended oral dose is 1 teaspoon dissolved in aloe vera juice or distilled water twice a day. Some of the cases that have been studied and published, Dr. Jacob gave his patients DMSO as IV therapy. Paralyzed or paraplegic people regained the usage of their limbs in these studies. One quadriplegic recovered enough to go through college and then got a job in a bank. A lady in Oregon had a stroke and received DMSO therapy only starting in the 4th month, and she was in a coma and was given little chance to recover. She did not respond to any stimulus. After starting the topical DMSO treatment along with the oral DMSO twice a day, her brain started to respond, and 4 months later she returned home. Continuing for years her DMSO treatment, this lady was living a normal life and walked normally in the end. Another case was a school teacher in LA that had a major stroke during Christmas, and DMSO treatment was started immediately. This lady was never taken to the hospital for further medical assistance, and in January she started her normal life again as a teacher. She recovered 100%, and she never ever mentioned she had a stroke. Another condition where DMSO has been proven to be highly efficient is called amyloidosis. It's a disease characterized by amyloid proteins abnormally deposited in various tissues. Amyloid is a protein with a secondary altered structure, which it takes on an aggregated insoluble form similar to beta-pleated sheet. There are known today about 60 different amyloids, from which 36 are involved in different human diseases. It is very difficult to diagnose them in the early stages, and many patients are going under or undiagnosed. Amyloids can affect many internal organs though, therefore it's important to treat this condition. Amyloidosis can be localized or systemic. For example, Alzheimer's is in the brain localized amyloidosis, while diabetes 2 is the pancreas localized amyloidosis. So the heart is also often involved, and symptoms such as arrhythmia, irregular heartbeat, up to congestive failure can be the consequences. The respiratory tract can also be systematically affected, as well as the spleen, spleen enlargement especially. Gastrointestinal tract can be under amyloid attack and manifest, for example, with diarrhea, vomiting, and hemorrhages. Conventional treatment of amyloidosis consists of administering chemotherapeutics and or steroids with a very limited success rate, and a study conducted at the Sackler School of Medicine in Tel Aviv University demonstrated DMSO dissolves the amyloid protein, and therefore DMSO can be combined with other drugs to be more effectively delivered topically and therefore help with amyloidosis. Another disease that is affecting more and more people around the world, I just read an article recently where it said that it's the leading cause of death already in the UK, and it's dementia and Alzheimer's. And here DMSO has also been proven to have great effects. The DMSO's properties help maintain mental clarity in general and good brain functionality, especially at an advanced age. It also supports immature brain cells to mature and increases blood flow in the brain. It can also prevent brain death cells due to the lack of insufficient oxygen at the level. It helps wire neurons due to DMSO's high polarity, and also helps maintain mental performance well into advanced ages again. It dissolves the amyloids. We talked already about that. Alzheimer's victims show also that in the brain a substance known today as beta amyloid, a product that results after the interaction of amyloid proteins and the brain inflammations, and that leads greatly to a misfolding of amyloid beta proteins. This is called the Kelly theory. In a study where Alzheimer's patients were treated with DMSO, they showed great improvements in memory, concentration, communication, and they also had a diminishing of the disorientation in space and time after only 3 months of treatment, and a very noticeable improvement after 6 months of treatment. Additional acupuncture stimulation with permanent implants inserted in auricular brain region specific for the hippocampus, that is the brain part that is responsible for producing new brain cells, has also been shown to help a lot of Alzheimer and dementia patients. And therefore a combination of these two therapies along with a ketogenic diet is for sure a great help for those patients that are trying to deal with this debilitating condition. All dementia and Alzheimer patients should be therefore, in our opinion, treated with DMSO as soon as the first decline in the neuropsychological responses is observed. Next up is another widespread condition of our times that is very debilitating, as you all know. It's diabetes. And here again, DMSO has been shown to have great success. So both for diabetes 1 and diabetes 2 patients, DMSO has proven to be very efficient in treating and alleviating the condition. For diabetes 1 patients, DMSO significantly reduces the risk of diabetic neuropathy, avoiding thereby loss of limbs, which is always very good if you can achieve that with a diabetes patient, because it increases the suffering enormously, of course. Some cases that have been reported when it comes to treating diabetes with DMSO There is a man who had diabetes all his life. He was not able to walk when he was 64 years old. He had poor legs and poor blood circulation to his feet. He could not feel the ground anymore. He was treated with topical DMSO twice a day on his feet and legs, and drank 1 tablespoon of DMSO dissolved in juice every day as well. And in only a few weeks, the feeling in his feet started to return and his walking got much better. He never had to think again about the limb amputation. Another case was a severe diabetic case in Ventura, California. This patient was also on the list of amputation of for his toes, and after being treated topically with DMSO, he showed significant improvements and no amputation was necessary anymore. Given just in time, DMSO also improves microcirculation by dilating the capillaries and the small blood vessels, which increases the microcirculation to all extremities. Combined with a ketogenic diet, exercise, and a healthy lifestyle, diabetes 1 does not have to be an early death condition anymore when you treat it like that. But there's more. DMSO has also been shown to be a fantastic product to be used in cancer therapy. It is the best free radical scavenger and the best detoxifying agent known to man. It passes through body tissues and individual cells, carrying other medications with it. It is actually the most potent anti-cancer medication by itself. Studies has also shown that DMSO by itself has a very positive effect on leukemia cells, as per studies, for example, conducted by Dr. Charlotte Friend and other top world virologists at Mount Sinai Hospital. A study was also conducted by Nova University in Fort Lauderdale in Florida. It was studied in combined therapy of DMSO and cyclophosphamide, an ester of nitrogen mustard, and although it is known that this drug is lethal when combined with DMSO in smaller doses, it showed a very strong anti-cancer effect with almost no side effects. If given early enough, the cancer was even completely cured. DMSO by itself greatly also enhances the immune system activity in cancer patients, and one of the most important studies on the use of DMSO in cancer therapy was done in Chile between 1969 and 71 at the military hospital in Santiago. 65 patients were qualified as cancer incurable patients, and most of them were treated beforehand with conventional medical methods without any improvements, and by adding DMSO to cyclophosphamide, its toxicity was greatly reduced, and also the quantity used in the therapy went down from 30 milligrams per kilo to 3 to 4 milligrams only. And there were 0 side effects observed as well. All the patients went into cancer remission, and almost a total pain reduction was observed in these patients. No morphine or other painkillers were necessary anymore, and by changing their lifestyle, many of the patients were alive years after the study has been conducted. Conclusions, therefore: chemotherapeutical drugs become less toxic and more efficient, and they are needed in much smaller quantities when you administer them together with DMSO, as the side effects of those preparations are also tremendously minimized. What has also been studied is DMSO together with lateral cancer therapy. Lateral is better known as vitamin B17 and is very well known for having fantastic anti-cancer properties. The medical establishment considers lateral as being toxic because it contains cyanide, which is poisonous, but they ignore the fact that to become poisonous, lateral must get activated by an enzyme called beta-glucuronidase, which is found in the highest quantity only in cancer cells. So the action of this enzyme releases from lateral hydrocyanic acid and benzaldehyde, both deadly but possible only in tumor cells. In healthy cells, there is another enzyme called rhodanase, and this enzyme, the cancer cells cannot produce it. Rhodanase neutralizes cyanide and converts it instantly into byproducts that are beneficial actually for your body. So lateral is therefore an anti-cancer product with great potential, and it cannot be toxic for your healthy cells. It just triggers the cancer cell death, and which are completely defenseless against the generated cyanide under the effect of the beta-glucuronidase. So adding DMSO to this B17 and vitamin C therapy and administering this via IV slow drip has demonstrated to even improve the anti-cancer effects of this therapy. Some cases that have been reported are, for example, of a lady that she was close to death due to a very aggressive tongue cancer and could not eat anything anymore. After the combination of DMSO with lateral and vitamin C, she started to eat already on day 3 and recovered completely. A very dramatic recovery that a medical doctor said about it in Pasadena. That is one of the most amazing recoveries he has seen in his practice when it comes to a terminal cancer patient. Another case was of an inoperable brain cancer in a 19-year-old patient, which is usually fatal within a very short amount of time, normally 3 to 6 months. This patient was treated also with a mixture of DMSO, vitamin B17 and vitamin C administered via IV. Over 20 years later, this patient is still alive and enjoying life, and no one knows what happened to the tumor. Another case is of a 56-year-old man. He lives in Los Angeles, had prostate cancer, and a terrible radiation cystitis caused by radiation that was given as a treatment for his cancer. He was bleeding heavily, and after already 3 days of DMSO plus vitamin B17 plus vitamin C therapy, the bleeding stopped and his cancer was completely gone. He continues also to drink DMSO mixed with aloe vera juice every day since then, and he's doing fine. Many doctors in the world have reported successful therapy results with DMSO when combined with the lateral, and reported that this treatment is significantly more effective than chemotherapy or radiation therapy for any kind of cancer. And here in this graphic you can see the interaction that we have described in the previous slide in a visual form, how vitamin B17 together with DMSO and even vitamin C, how they interact with each other and with the cancer cells. The B17 molecule is unbreakable in nature except for glucosidase, as we said, and there is 3,000 times as much glucosidase in the cancer cell as there is in a normal cell. Therefore, it attacks only the cancer cells, as we have discussed already, and here you can see a nice graph depicting how this whole system works. But that's not all that DMSO can do for you when it comes to cancer therapy. It's also very, very beneficial when you're already receiving radiation therapy because of its radioprotective properties. They have been very well known for over 40 years, and therefore it is logical to us that DMSO therapy must be used in conjunction with any kind of radiation therapy. Cases here where, of course, it has been already proven that it works. DMSO was applied, for example, topically to 22 cervical cancer patients prior to the radiation procedure. 59 patients received radiation without the DMSO protection, and the 22 patients did not get any radiation burns or other toxic effects, contrary to the other patients that did not receive the DMSO. A lady also with lung cancer in LA was recommended to receive a heavy radiation therapy of her lungs, and the doctor did not allow to give her DMSO protective therapy. She had terrible lung burns, and only after she finished her radiation therapy she started to take DMSO, and she recovered. In this case, it was a doctor's mistake not to apply DMSO before the radiation therapy. And another lady with lung cancer was also receiving severe radiation therapy, but her doctor allowed her to get additional DMSO therapy before and during the radiation, and she had no burns and no other toxic effects and recovered completely from her cancer several months thereafter, having a normal life. 3 years later, she was perfectly healthy, and she's expected to live for many more years in a healthy state. So there you can see that DMSO is really, really useful also when you're receiving a traditional radiation therapy. Enough for now about cancer. What about liver cirrhosis? Well, it has been proven that it's also very beneficial with this condition. There was a study, for example, of 12 homeless people that lived in downtown LA. And they presented all liver cirrhosis symptoms and were considered terminal, so a death within 1 year at the most was predicted. They were selected for a therapy with 1 tablespoon of DMSO diluted in 1 ounce of aloe vera juice twice per day, and were imposed to give up on alcohol and drugs, of course. 8 of them who respected the alcohol and drug restrictions succeeded in living years thereafter, stopped having cirrhosis symptoms, and enjoyed a great healthy life. 4 of them did not respect their requirements and did not survive, unfortunately, and thus it is clear that DMSO alone is not enough to survive liver cirrhosis, but it can greatly help when you give up on the toxic substances that caused it in the first place. DMSO can also help you with gastrointestinal diseases. Digestive disorders of different types are difficult to correctly diagnose as well as to successfully treat, and DMSO has proven itself to be a very good helper, and many times it can solve difficult problems that are normally considered terminal or chronic. Some cases that have been reported are, for example, of an 8-year-old girl in LA. She was vomiting daily after breakfast and was diagnosed with internal bleeding caused by a very bad fungus infection. A surgery to remove large parts of her gastrointestinal tract was considered to be the only and first choice, and after another doctor treated her with DMSO twice daily, the vomiting stopped after 3 days, and after 2 weeks the bleeding was totally gone. Another case was reported by Dr. Al-Salim, who treated many patients with DMSO, as they are considered to be the very best free radical scavengers known to mankind, as we've discussed already. In one of his studies, he studied stress-induced gastric mucosal injury in patients with pelvic fracture and hypovolemic shock. 57 patients from 177 were receiving DMSO with allopurinol, and 67 only allopurinol, and the results for patients that were given the DMSO with the allopurinol together was that they performed much better, and they showed the positive results much faster. Dr. Salim also studied whether or not free radicals are involved in the recurrence of duodenal ulcers. This study involved 302 patients, and all of them healed faster and completely when they were treated with not only allopurinol, but allopurinol in conjunction with DMSO. Another study was of 5 ulcer patients in New York City that suffered from duodenal ulcers off and on for 10 years. They were all heavy drinkers. Treatment here was 1 tablespoon of DMSO in aloe vera juice, and after 1 year they had no more symptoms of ulcers, and endoscopically it was stated that they completely healed their ulcers. DMSO can also be of great help with infections by itself and in combination with antibiotics. It's an excellent choice for all kinds of infections, as it has the capability to destroy the biofilms and penetrate cells and the brain barrier and activate the immune system as well as the blood circulation, which all reduces inflammations. Some cases, 43-year-old man in LA that had a heavy crushing wound on his foot, which did not heal. It got infected, different antibiotics were tried and none helped. And when he was given an IV with DMSO plus the antibiotic, there was an immediate improvement. 2 weeks later, the wound was completely healed even. Osteomyelitis is a serious and difficult to treat infection of the bone and bone marrow, and often the amputation is the ultima ratio, or the infection can become fatal even. Here a case is reported. A 36-year-old man in California stepped on a large nail which penetrated deep into his foot and got infected down to the bone. He was in terrible pain and had, of course, troubles with his mobility. After weeks of trying antibiotics alone with no success, when the antibiotics were combined with DMSO, spectacular improvements were observed. It may happen that antibiotics with DMSO, the solving biofilms, are not impacted by the so-called antibiotics resistance. That might be one of the reasons why it works so well. Another case was of a 90-year-old man in LA who was suffering from severe bladder infection caused by a previous prostate carcinoma surgery. He was on diapers for many years due to his inability to control the urination. He was treated conventionally with antibiotics and cranberry juice, but he was still infected and no improvement was possible anymore. And finally, DMSO was added to his normal therapy, and after only 4 days, the man returned home perfectly healed and the infection never returned again. DMSO was also approved by the FDA as a treatment for interstitial cystitis, which is an inflammation of the inner bladder mucosa not caused by an infection. Since 1978, DMSO is the single treatment of this condition and is still very successfully applied today. Many doctors combine DMSO that is given directly in the bladder to the bladder via catheter. So installation with the classical 1 tablespoon in 2 ounces of aloe vera juice given orally as well. And both interstitial cystitis and radiation cystitis as a result of radiation cancer therapy, which are both very serious problems, can be treated very successfully and have been treated very successfully with DMSO in conjunction with other treatments of choice. So, conclusion time. DMSO, as we have seen, is a natural product that exists in all plants. It is produced during the separation process of wood components, of cellulose and lignin. It has extraordinary physical and pharmacological properties and is the best known solvent known on this planet today. Due to its very high polarity, DMSO is the best water and fat solvent. It has also absolutely unique therapeutic properties and is one of the most important remedies ever for the relief of human suffering when you ask us. It is useful, and as you have seen already, so many serious conditions that can be improved upon just by this very simple molecule that is natural, has no side effects. Even when you combine it with many traditional therapies, it improves the results of those. It is useful in combination by itself with the conventional therapy, with alternative therapies. It's amazing. It has also been proven to be extremely safe. Never any adverse toxic reactions or death cases have been reported when DMSO was used. Every doctor should become knowledgeable, therefore, about DMSO treatments, and they can be incorporated in any practice with serious benefits in the therapy of almost any disease, as we have seen. For sure, many serious diseases that affect many patients today, like diabetes, cancer, Alzheimer's, dementia, etc., as we have seen. The DMSO is one of nature's healers, among the most efficacious ever uncovered, and you, the patients and the doctors, are entitled to use it. So it's legal. With DMSO, total pain relief is now is possible. Serious and almost terminal pathologies are reversible, and good health is reachable at a very low cost. That's also a great thing about DMSO. It's cheap, it's legal, it's not well publicized because there's not a lot of money in it for the pharmaceutical companies, but as we have seen, there is enough studies from all over the world that have proven it to be very, very efficient with many conditions. You can also do it at home. That's the great thing about DMSO therapy. Once the protocol has been established in conjunction with your therapist or your doctor or your practitioner, your holistic practitioner, you can take, for example, 1 tablespoon of DMSO, 57% dissolved in 1 ounce of aloe vera juice, and you will feel improvements immediately. Apply also like DMSO highly concentrated topically, where you have a pain or wound or muscle pain, whatever it might be, and within minutes you will feel relief and the healing process will immediately start. So overall, you need to educate yourself about DMSO, and that's what we've tried to do here with this presentation. I hope that you enjoyed it and you found the information useful. As always, contact us if you have further questions, lyranara.com. We're happy to talk to you, and until next time, stay healthy.